Hi, I'm Dr. Ashley Bourgeois. I'm a board-certified veterinary dermatologist, also known as the Derm Vet. Today, we're going to talk about atopic dermatitis. Well, thank you so much for joining me today. I love talking about atopic dermatitis. It's one of my favorite topics and something so common that we see in cats and dogs. I originally did my undergrad degree at Iowa State University and then did veterinary school at the University of Missouri, followed up with a rotating small animal internship in medicine and surgery at Purdue University, and then followed my love for dermatology, doing a residency with Animal Dermatology Clinic in Orange County, California. I'm still with that company, but I've relocated to Portland, Oregon, where I am part owner within the company and on the board of directors. I also found a passion for teaching general veterinarians about atopic dermatitis, cytology, and all sorts of other dermatologic diseases, which manifested as the Derm Vet, a social media presence I have that's also become a podcast, just trying to get you guys really tangible tools that you can use in the clinic in order to practice better dermatology. So let's get started on this topic. So the first thing we have to think about when dealing with atopic dermatitis or any sort of allergy is pruritus. What does that look like and how does that affect the owner and the patient? Pruritus or itch can look like lots of different things. It can be scratching, chewing, licking, rubbing, head shaking, scooting. So when we ask owners if their pet is itchy, it's really important that we start with being really specific on what type of itch is present. Because sometimes if you just ask a client, is your pet itchy? They'll say no. But then when you mention, well, do they chew their paws? Oh, yes, incessantly. So it's actually really important to get specific with all the different types of ways that allergic itch can look like. Sometimes dermatology is easy to brush away and say, well, it's not that big of a deal. It's often not fatal, something that, isn't as critical. But there's been several quality of life studies looking into pets with allergies and how it affects the quality of life of that pet and that owner. These pets can be uncomfortable. Owners can be stuck not sleeping because their pet is chewing and licking and disrupting their ability to get rest because they're so infected or itchy from their allergies. They can have aesthetic differences. So some of these pets lose their hair, they get really red faces or red skin, they can get that really greasy lichenified skin. When you get a pet, you're excited to take them places and to have your friends and family come see them. So then if you're all of a sudden embarrassed because your pet is really stinky or uncomfortable, or if they have a bad ear infection and your child goes to pet them and they scream in pain, or maybe they even want to bite because they're so uncomfortable, those are things we really have to think about for our owners who have allergic pets. So quality of life studies show that they are absolutely affected, the patient and the owner, just by having an allergic pet. But what these studies also show when we look at things like caregiver burden is you can restore that quality of life just by managing them. So though allergies don't completely go away for our patients and they have to be managed long term, we can actually return their quality of life and the caregiver burden to a normal quality of life and a normal caregiver burden by simply managing that disease and communicating with the owner. So when we see these pets in the clinic, the first thing we need to make sure we're recognizing is if there's a secondary infection present. No matter what type of allergy you're dealing with, it is very common to get secondary bacterial and yeast infections. And this includes the ear canal and the skin. So we need to be very diligent in the clinic to do the cytologies. And if you follow anything I do, I love to cytology everything. And the reason is I'll get several patients who come in who have seemed to not improve with certain therapies, but it's because their infection was never addressed or seen, or a cytology has never even been done to catch that. So we want to make sure we're doing our cytologies on these patients, because having itch associated with an infection can compound on top of that allergic itch and make these pets a lot more uncomfortable. And you can reduce their itch and improve their quality of life just by treating that infection. So we want to make sure to get our slides out, and there's several different ways you can do cytology. You can do a direct impression smear. Some people will do tape preps of the paws and claw folds. One of my favorites is to take a toothpick out and actually sample the claw fold. Whenever a pet is really pruritic, chewing, licking those paws, you definitely want to make sure those claw folds are clear, because it's really easy for the skin on the claw fold to hide a lot of that brown debris or that purulent debris that could be making that pet chew those paws overnight and causing, again, that owner not to sleep. So get your toothpicks out and get the glass slides out. You also want to make sure you're looking in those ear canals, because ear canals can hide a lot of infection that maybe we don't necessarily see or smell when we're just looking at the pet. Though sometimes you can see or smell it. So you want to make sure we're getting that otoscope down the ear canal. And if there's anything that looks abnormal, or if that pet is rubbing their head on the ground or shaking or seems uncomfortable when you're doing that otoscope exam, then we want to sample with a cotton tipped applicator and take that swab and smear it on a slide and just make sure there's no secondary infection. If we take the time to do cytology and find these infections, no matter what the underlying allergy is, we're going to end up with a more comfortable pet and a much happier owner. So in order to come to the diagnosis of atopic dermatitis, we have to make sure to do the appropriate rule outs. So diagnosing atopic dermatitis means we've ruled out other things that can cause pruritus in our pets. So we talked about cytology and infection and why ruling that out is important, because it can really happen in any of these allergic diseases. But one of the easy things to rule out is something like a flea bite hypersensitivity. The nice thing is there's other ectoparasites like certain mice and lice that can also cause pets to have abnormal skin, pruritus, and we can rule those out with some of the newer flea products that are out. So any of the isoxazolines really should help us rule out all these different types of ectoparasites that cause pruritus. But we also know that pets that have atopic dermatitis have a higher predisposition to also have flea allergy. So you can have both of those allergies present, and if we don't control the simple things like a flea bite allergy, then that can cause our pets to not look like they're getting the relief that they should have. So depending on your location, using something like a high speed of kill flea control can be really important. And in a lot of parts of the US, where I am in the Pacific Northwest, we have to use it year round. So that can vary depending on where you're at, but we definitely want to make sure that these pets are on high quality flea controls. Sometimes we see pets that tend to be more pruritic towards the dorsal lumbosacral region if they have flea bite hypersensitivity, but you really can show signs of pruritus anywhere. So that can be a good indication or a high suspicion, but you just want to make sure any pet you're diagnosing or trying to diagnose allergies, that you just have them on a really good ectoparasite control. So after making sure the pet's on really good ectoparasite control, we want to potentially rule out a food allergy as well. So if you have a pet who has non-seasonal pruritus, then ruling out something like a food allergy is really important. The other important thing to realize is, again, a lot of atopic dermatitis patients also have a food allergy. So you can have multiple types of allergies that can make working at these pets really difficult, because if you don't have all of those allergies aligned and controlled, the pet may never seem to get that much better. So when diagnosing or ruling out a food allergy, the only way we can reliably do it at this point is through a really strict diet trial. Unfortunately, there's no serum or saliva testing that has been validated or deemed reliable based through the literature, even though they're out there and people can find them. So you really have to do that strict diet trial to rule out a food allergy. You want to do the diet trial for at least 8 weeks. And again, you have to be really diligent to talk to your owners about what strict means. So no table scraps, rawhides, flavored chews, things like that. And then at the end of 8 weeks, if the pet's doing better, and hopefully we've been able to take away things like antipruritics if we've needed them, we can do a dietary challenge where we mix in the previous food with the new dietary challenge food and see if they flare or not. Usually you see a flare pretty quickly within a day, maybe a few days. And this could either be their skin or through their GI system. It's also important that you use a really good diet to feel confident in that diet trial. So usually suggesting a prescription diet that's either hydrolyzed or novel protein is recommended because we know they've done the testing to assure there's nothing else in that food that could complicate our diet trial. Now we have ruled out flea bite hypersensitivity and food allergy, and so we can feel confident if there's still clinical signs that this pet has atopic dermatitis. And the tricky thing about atopic dermatitis is it can present seasonal, it can present non-seasonal, it can present as paw chewing, rubbing, licking, ear infections, skin infections. So there is a huge amount of ways that pets can present with these clinical signs. And sometimes owners don't pick up on all the clinical signs that they are showing at home, and they'll just come in with a single complaint. When you look at that pet and you do a thorough dermatologic exam, you may pick up on lesions that the owner didn't even notice. So it's really important that we're really complete with our history and with that dermatologic exam. The other thing we can see pets with atopic dermatitis do is start out seasonal, maybe when they were younger, and then as their allergies have stayed with them and they've aged, all of a sudden they are non-seasonal, or they have developed other clinical signs. So it's really common for us to hear a pet started out with just some paw chewing in the summer when they were a couple years old, and now that they're 7, they're just licking and chewing everywhere on their body all year round. So looking for things like that progression can be really important in these cases. You also have to make sure something else like a food allergy maybe didn't pop up later in life. And this is where these allergy cases can be really difficult to figure out. When we know the pet has atopic dermatitis because we have done those appropriate rule outs, that's where something like environmental allergy testing can be really helpful. So I mentioned food allergy testing is not reliable, but environmental allergy testing is. But the only reason you really want to refer a pet for environmental allergy testing is because they're going to pursue immunotherapy. So allergen-specific immunotherapy is something that we formulate based on those allergy test results. It's not realistic that we're going to allergy test a pet and then expect them to just avoid those things in the environment. Things like dust mites and weeds and grass pollens are everywhere. So we have to desensitize that pet by using allergen-specific immunotherapy. We also don't use skin testing as a rule in or rule out of atopic dermatitis. When we allergy test a pet, we know that they have atopic dermatitis. We're doing that test for the purpose of formulating immunotherapy. So again, atopic dermatitis is going to be a diagnosis of exclusion. We look at the history, we look at the clinical exam, and we've already done our appropriate rule outs of cytology for infection, making sure they're a really good ectoparasite control, and then potentially a food allergy depending on their history and what they've already done. And then we know they have atopic dermatitis. So once we know we have it, we can test them if the owner is willing and able, and then we can move on to symptomatic care to make that pet more comfortable. Starting immunotherapy can take a long time to see an effect. So we want to make these pets comfortable right away. When we specifically look at dogs, there are 2 medications that are on label for canines that can provide a lot of relief. Oclacitinib is a tablet that can be administered at home by the owner. It can have a fast effect on pruritus. You can start the tablet twice daily for up to 14 days, depending on how that pet's pruritus level is. and make them a lot more comfortable, but then we drop it to once daily as we're keeping them on maintenance. Remember, we have to manage their allergies. So we have to keep these pets on something. When I'm starting a pet on immunotherapy, I might use something like Oclacitinib for several months while that's having an effect before we try to stop it. Another option is an injection given in the clinic. Canine atopic dermatitis immunotherapeutic is a really safe therapy that specifically targets interleukin 31. It's only for dogs, but you can give it in the clinic and have 4 to 8 weeks of relief for that pet. So either of these therapies are for dogs and are very, very fast, very safe, very well tolerated. And they can be really great tools, whether you're ruling out something like a food allergy and you need some relief while a diet trial is being started, or you're just trying to provide some comfort. So I'll decide what's needed based on the age of the pet, what the owner can do at home. Maybe it's easier for them to give a tablet, maybe coming to the clinic so they don't have to give a tablet once a month is no big deal, or maybe one works better than the other. So having a starting point that we can just provide relief in a really quick, safe way is really important in these patients. 2 other systemic options that can be used in atopic dermatitis are Cyclosporin and Corticosteroids. And these can be used in dogs or cats. Cyclosporin can still be a great option for atopic dermatitis. It's more anti-inflammatory, and especially if the pet has any other autoimmune diseases like IBD, it can be really beneficial. It can cause some gastrointestinal upset, so we have to have owners keep an eye out when we start it. It also can take a bit longer to have an effect. So it can take a couple weeks up to a month to fully see how that pet can do on the medication. But it can take a bit longer to have an effect. So sometimes a week, maybe up to a full month to see how well that pet does on the medication. We also have to watch for a gastrointestinal upset and forewarn owners to keep an eye out for that. But it can still be a great medication, and some pets respond really well to it, especially in cats where options on label are a bit more limited. The other option are corticosteroids, and there are several types of corticosteroids available either injectably or orally. They can provide fast relief. They have a really vast anti-inflammatory effect, but they have side effects we have to be aware of. So polydipsia, polyuria, polyphagia, panting, all of those can be really fast side effects of steroids. And then obviously there's longer term side effects such as diabetes, especially in cats, being cautious of cardiac disease that we have to be aware of if they're used more long term. So when selecting a therapy, I really try my best to avoid corticosteroids if possible, but some cases need them if they have stenotic ears or just have not been responsive to other therapies. Though systemic therapy is great and one of the anchors to controlling and treating atopic dermatitis, topical therapy is essential in these cases. We want to use topical therapy like bathing so we can remove pollens from the skin and help restore that epidermal barrier. But what's also important is we know allergic patients are susceptible to secondary infections. Even when we have their allergies well controlled, flares can happen. We can miss a flea control. Summer can come with really bad pollens that just overpower the systemic therapy that we're using. So using things like frequent bathing, even when they're doing well, as maintenance can be extremely beneficial in these cases. Using products that have medications like chlorhexidine to help treat active infections, but also keep the skin from getting reinfected all the time from their allergies is really important. There are also newer products out, such as ones that contain salicylic acid and sodium hypochlorite that have had really good support in the literature behind their usage in keeping atopic dermatitis controlled, but also treating active staphylococcus infections. So make sure you're bathing these patients often and frequently, even when we think their allergies are well controlled, because it can help us prevent those recurrent infections. Besides bathing, there are other topical therapies that can be really useful for these patients. Some owners can't bathe all the time, so having alternatives can be really important. Things like mousses or creams or sprays can allow us other ways to get topical therapy on these patients and restore their epidermal barrier. There is a hydrocortisone leave-on conditioner that can be really helpful in pets that have pruritus from their chronic allergies. And there are mousses and sprays that have products like chlorhexidine in them that allow us to get that anti-infective property without necessarily bathing if the owner can't, or they just can't do it as frequently as we hope with their lifestyle. So in summary, when we're ruling in or out atopic dermatitis, one, we have to recognize the itch and have the owners be able to recognize the itch at home. We have to do the appropriate rule out. So we check infection with our cytology. We have them on good ectoparasite control. We do a diet trial. And when we know that atopic dermatitis is present, then we're putting them on systemic therapy like allergen-specific immunotherapy or the others that we talked about today. And we're really focusing on topical therapy, like frequent bathing, so we can stop the recurrent infections and restore the epidermal barrier. This is a huge topic, and you'd love to go more in depth into atopic dermatitis or any of the other allergies, then I really dive into these on my podcast, the Derm Vet Podcast, or on my social media, Instagram or Facebook at the Derm Vet. Until next time, I hope you keep having fun with this dermatology cases and feel better about treating atopic dermatitis.